Is there a cure for sciatica? That's a question we get asked frequently in the clinic, and the answer is it depends. As I've mentioned on a previous series of videos, uh, about 10% of patients with severe sciatica need surgical decompression. And that's really because there's no option but to remove the pressure on the nerve, because the nerve can be left permanently damaged with paralysis and weakness in the leg if it's not decompressed. So that's a 10% of the sciatic population, and they're easy to identify clinically. They're usually very disabled with the level of pain they have, often stuck in a bent position or a side shifted position, aren't able to tolerate weight bearing, aren't able to function. They have continuous pain in the leg, which is the sciatic nerve being compressed. They will often have power loss and changes of sensation in the leg. So people in that very severe category, usually the MRI scan will show a large disc protrusion, which would be consistent with the symptoms they're reporting. And usually at that level of severity, you know that a surgical intervention is the most appropriate thing. So they're a pretty easy group to recognize, mainly because they're very, very disabled from their symptoms. So where does that leave the other 90%? Well, there's a really big scale of variation from somebody who has a low-grade disc bulge, where it may just bulge after a prolonged period in the garden, or a long distance flight or something along those lines. So that little bit of bulging can cause some minor irritation on the nerve, and then once the inflammatory reaction settles down, then the nerve is no longer under pressure. So that's a group who would have intermittent sciatica, or somebody who has poor muscle control around the spine and pelvis and may play a game of tennis or golf or kick football with the grandkids, and may get some intermittent nerve irritation as a consequence of that. So that would be somebody who we know is in a vulnerable situation, but there are specific mechanics that provoke it, and the clinical challenge is to try to understand, well, why is the nerve essentially being challenged with those level of activities? Do people have sufficient flexibility in the target tissues? That's one common cause. So if there's stiffness in parts of the spine, that will often put pressure on a certain area, and that can be enough to cause nerve irritation. Often people will have some evidence of disc bulging on scans. In fact, the statistics are that about 50% of the population will have some evidence of bulging of a disc when MRI scanned and over after the age of 40. So disc bulges by themselves are pretty prevalent. It comes down to really whether the bulge is sufficient to put pressure on the nerve, for one, whether people's lifestyles are challenging the mechanics of the spine and therefore potentially compromising the nerve. That's another issue. It comes down to the general muscle control and whether they're keeping fit and active. So there's a number of different factors, and that's what we look for clinically. Probably the most difficult patient grouping are the ones who have intermittent nerve root pressure, some small degree of bulging evident on the scan, but not sufficient that a surgeon would say, well, we need to decompress here, but either have reached a plateau in terms of their response to treatment. And by that I mean they've restored as much mobility as they can in the spine, they've improved their muscle control, they've looked at ergonomic factors that may be driving things, and if all of those things have been done and they still have intermittent symptoms, then they may be candidates for what are called invasive pain management procedures, which are things like epidural injection, which is just an anti-inflammatory injection, a steroid into the spine, and that tries to reduce some of the irritation in the tissues. They could be a candidate for a nerve block, which is just a slightly more specific version of an epidural. It really is a steroid injected around the inflamed nerve root. And sometimes just doing those kind of procedures that settle the inflammation down, provided the factors which keep causing the recurrent irritation have been improved to their best capacity, well, that can sometimes give people a long window of recovery. There's another group of patients who've had maybe a history of severe sciatica in the past, which has subsided, and then 10, 15 years later start to develop sciatica again, but usually this time they don't have the associated back pain, and that's usually because there's been more degenerative change happen in the joints, and because it happens slowly over time, the joints aren't particularly sore, but what happens is that the disc that originally bulged becomes quite hard and bony, and those bony projections can put pressure on the nerve. So it's often missed, certainly in patients over 50, where they have vague recollections of being very disabled from acute sciatica when the disc was a more soft fluid-like structure, or jelly-like structure, should I say. But in the older spine, very often there isn't a lot of back pain associated with nerve irritation, but nonetheless it's still significant nerve irritation, so one needs to be mindful of looking out for that clinically. And usually somebody in that situation, they have quite restricted movement in the spine, and as you try to work to loosen the spine off, you really don't see much change, and you'd really see that happening over 3 or 4 treatments as to whether there was an improvement happening or not. And that's sometimes a surprising case, because people don't often think, oh well, the problems are coming from my spine, and it may be just as severe a nerve root problem as the original acute sciatic issues when they were very disabled. So that's one we see frequently in the older population. So the answer to the question, is there a cure for sciatica? It really depends on where you are on the scale. On the very severe end of the scale with severe disability, that's the estimated 10% of the population, that's a surgical job. For the other 90%, usually there are combinations of physiotherapy involving manipulation, stretching, postural correction, muscle imbalance work, neural mobilizing techniques, these kind of combination of things which can significantly improve symptoms. And you usually know that within a short course of treatment, over 3 or 4 treatments. That doesn't necessarily mean that the condition is resolved, but one knows if it's improving and moving forwards. And then if there's a group of patients within that start to plateau or stabilize, then they select for more invasive pain management if people are prepared to go that route. So there's a few different management strategies depending where you are on the scale. So it isn't a one size fits all solution. But that's usually the way life is. Hope you found that informative. I'll see you again in another video. Bye for now.